Hello, I'm Andrea Perry. With over 60 years of service in Chattanooga, Fortwood Center is one of the area's leading providers of outpatient mental health services for both children and adults who suffer from mental illness. Last year alone, we served over 5,000 children and adults. We are a nonprofit mental health organization that strives to serve children and adults regardless of their financial circumstances. Established in 1947, Fortwood Center started out as the Chattanooga Child Guidance Clinic. Later, the name was changed to the Chattanooga Psychiatric Clinic. In 1984, the clinic adopted its current name, Fortwood Center Incorporated. Mental illness is a treatable disease, but in its most serious form, it can rob a person, even a child, of their ability to work or function at home or in school. Our goal is to control the symptoms as quickly and completely as possible. Once the person is stabilized, we work on helping them become as independent as possible, including returning to work or school or finding the proper living arrangements for them.
Fortwood is and has been a lifeline both for being an employer and keeping me in my apartment and helping me maintain stability in my personal life. To take a look at, what I'm costing the taxpayer in the hospital versus out of the hospital, you just decrease your cost to the state by hundreds of dollars, if not thousands, and it's really nice to be a part of a decrease in expense when everything else seems to be going up. I never thought I would need the services that Fortwood offers. I did, I do, and I'm grateful. You can't do better for yourself than that, and I really want to say I appreciate it.
Fortwood Center operates 2 outpatient facilities, 1 supervised residential home, 4 independent living apartments for 8 adults, and a peer support center for adults. Fortwood also contracts with 3 additional 8-bed group homes for adults needing 24-hour supervised care for a total of 32 supervised residential beds. In providing for seriously emotionally disturbed children and mentally ill adults, we employ a highly trained staff of 1 child and 1 adult psychiatrist, a nurse practitioner, licensed therapist, and case managers to assure a proper diagnosis, treatment, and follow-up. We also employ a mobile crisis team that's on call 24 hours a day, 7 days a week for adult mental health emergencies. Fortwood Center, in many cases, serves as the last resort for help for children and adults with severe mental health problems. Fortwood's school and community outreach programs have provided care to students in 78 of our local schools.
A lot of times our students come to us lacking social skills, and what's great about Fortwood is they help our students develop the skills that they need to be successful. And many times students in kindergarten may come in with a lot of issues, and by the time they're in 3rd grade, we don't see those issues anymore. The prevention, you can see it working. The students are better able to communicate. They feel better about doing their schoolwork. So academically, there's greater success with those students.
The 2 most diagnosed problems we are seeing with youth are attention deficit hyperactivity disorder and depression. Untreated depression is the #1 cause of suicide among teens, and suicide is the 3rd leading cause of death among children. Early intervention is our best prevention when an emotional problem manifests itself in a child. Our goal is to prevent the condition from progressing into a more serious problem. In the long run, we believe this will improve the child's school success and their future as adults.
Hello, I'm Earl Midley, CEO of Fortwood Center. At Fortwood, we try to provide the best mental health care possible for adults and children. However, we realize that we cannot do this without your support. On behalf of the Board of Directors and staff at Fortwood Center, we thank you for helping us build a stronger community, one restored life at a time.